Hi, Miss. My name's Mark. I'm going to be one of the nurses helping you out today. We're going to do a real quick physical assessment here. And sorry, evidently, our office is inundated with cats, so this might be something we struggle with throughout the assessment, but we can try and chase them off as need be. So we're going to start off looking for the point of maximum impulse, which would actually be on the fifth intercostal space lateral median here, or lateral aspect here. Unfortunately, with it closed, it's going to be difficult to assess that. That would be something where I would place my hand flat, and we would feel for the point where we feel the maximum pulse. We're also going to go through and we're going to auscultate the 5 points, which are going to be our aortic arch. Good. Pulmonic arch. Our tricuspid valve, which would actually then be a little bit lower. And mitral valve. And our frame marks for that would be sternal notch and just a little bit below where we can feel it getting the level of the second rib. So we have our landmarks for the aortic arch. All right. If I was trying to assess the S1 sound, that would be near the apex. So that would be down by our tricuspid. And sorry, underneath here. All right, good. And if I was trying to assess the S2, that would be closer to the base of the heart. So I would be looking right around the pulmonic area. Good. And if I were trying to assess where S1 and S2 are equal, that would be Erb's point, which would be in between the pulmonic and the tricuspid region. Good. I don't hear any adventitious heart sounds. Good. I don't hear a split S2, nor do I hear any obvious murmurs. All right, we're going to go through and we're going to do that again with the bell. And again, our landmark, pardon me, down to river 2, and the aortic arch. Good. Good. And again, no murmurs noted. Good. Good. All right. So now we're going to assess your respiratory status, and to do that, we're going to start by just visualizing chest wall movement. So I want you to take a couple of nice, slow, deep breaths for me. Good. Chest wall movement looks symmetrical. No accessory muscle use. I don't see any triboding or any signs of respiratory distress. So, very good. Now, I want you to say blue balloons for me.
Blue balloons.
And again.
Blue balloons.
And again.
Blue balloons.
Good. And again.
Blue balloons.
All right, good. And checking for tactile fremitus there, and what I'm looking for is to feel a little bit of vibration. I don't want to feel no vibration, but if I feel excessive vibrations, it might be a sign that there's some consolidation or an ammonia that might be brewing. Good. Now we're going to percuss the posterior, which basically means I'm just going to take one finger here, my non-dominant hand, and tap it with my dominant hand. And what I'm looking for, and the sound will vary a bit here over scapular regions and others, but I'm looking for most important symmetry of sound. But I also want to make sure, good, that as I do this, I don't hear any dullness or any excessive timpani. Good. Sounds good. All right. So now we're going to take a listen. And what I'm going to do is I'm basically going to go on both sides, down, here, and then same thing again on your back. And again, we're just going to go from side to side. I want you to focus on taking steady, smooth breaths, a little bit deeper than usual. Good. 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 A few more here, and then we'll be done in the front. Good. Sorry.
Okay.
All right. One more.
Do my turn.
Good. No, you're fine. And we're just going to go same thing on the back. Good. 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 Nice, clear, symmetrical breath sounds. Good. Good. I know this is a whole lot of excessively deep breathing. Almost done here. Alright, good. And now we're going to do the same thing. A few more. This might take a little bit. Good. Good, good, good. Alright, I did not hear any wheezing, stridor, or rhonchi, so all sound very good. Definitely hearing symmetrical lung sounds. The bronchial sounds, which are going to be your higher pitch sounds, are going to be heard when I'm assessing right here. Bronchiovesicular, more of a lateral approach. You don't necessarily want to hear bronchial sounds when I get out to the actual lung fields themselves. And the vesicular sound is just going to be a very quiet, very almost whispery noise, which I did hear. No increase in tone, which I'd be concerned about, like an air trapping, and obviously, or excuse me, consolidation. And no signs of air trapping either. So good news there. All right, so far everything's going pretty good. Now I've got a weird thing for you to do. We're going to go over one of the tests they can use in the absence of imaging studies, agophony. So what I want you to do is say the letter E, just like that. And one more time. Excellent. I don't hear any raise in pitch or something sounding similar to an A noise when I'm listening, so that's a good indication that there's not any sort of actual consolidation. So excellent, glad to hear it. And I'm trying to think if there's anything else that we want to cover for the cardiac point, or for the cardiac or the respiratory assessment so far that I may have missed. We'll get to your carotids in a bit. If I wanted to listen to the mitral valve specifically, I would have you probably lay in your left, and I would try and assess right here, which we did earlier just in general, but I'm not going to reposition you at this point. All right, so that sounds good. Now, for the carotids, what I would be doing is I first want to check and say I don't see any pulsations, nor do I see any sort of bounding pulse. Good. And say that's +2 to +3. Good. And we're just going to take a listen here with the stethoscope. See if I hear any burns. Yeah, good. All right. Thank you. Now, we're going to move on and just do a very quick assessment in your head. So, first off, I can just visually see that symmetry appears to be intact. Looks like you have thick head of hair. Not seeing any scalp irritation or inflammation. Or critters. Symmetry is there. No tenderness. No abscesses noted. All right, good. Now, I want you to smile at me. Stick your tongue out at me while we're at it and wiggle your tongue around. Perfect. Now puff your cheeks out. Perfect. All right, I'm seeing definitive symmetry. It looks like we have no facial droop, no weakness, no lingual weakness. Unless you decide to have a stroke in front of me, which would be a different assessment, but you could do that. All right. And want you to open and close your mouth for me? Good. Any pain?
No.
All right, good. So we want to have you take a deep breath while I include one nostril. Good. Same thing with the other. Feel like you're breathing all right with that? All right, perfect. And gonna check your sinuses here. Any pain where I'm pressing? No? Okay, good. Glad to hear it. So it sounds like we've got most of that done in terms of assessing the symmetry of your face, your head, your nasal patency. Open your mouth for me again. Good. And one more time. This is me shining my imaginary pen light in. Good. I don't see any obvious caries. Both the soft and the hard palates look pink. Oral mucosa are moist. I don't see any sign of gingivitis or other sort of gum disease. Appears well hydrated in general. All right. Now, any pain in the lymph nodes? No. Trachea appears to be midline. No deviation noted. Had assessed earlier. Did not hear any stridor or signs of tracheal compromise. Good. I want you to take your head and turn it towards this shoulder. Good. Same thing the other side. Good. Now take your chin and just turn it to your right shoulder. Good. And now same thing with your left shoulder. Perfect. Good range of motion, strong. Excellent, excellent, excellent. All right. Well, I think at this point I've harassed you long enough, and we'll get the doctor on in a couple of minutes to see you. But thank you very much for letting me do the assessment for you here.